I'm just going to, prior to the start of the main webinar, I'm just going to spend 5 minutes introducing you to the role of Consortia Lead and to the East of England Healthcare Science Training Network, which may help to explain my role here today. If I could have the next slide, please. Oh, no, sorry, you got it. OK, thank you. So I'm a respiratory physiologist working at Royal Papworth Hospital in Cambridge. I've been involved in many of the training programmes over the years, and particularly recently with the STP programme, being training officer since 2013. Being a cardiothoracic centre, it's been a really successful programme for Cambridge at Papworth. And we've trained over 20 cardiac STPs, I think 5 respiratory and sleep STPs, and more recently including 5 critical care trainees. So it's been a really useful programme. And as a tertiary centre, we've been lucky because we've been able to fulfil and accommodate all the specialist training modules that you need for these programmes. But the downside is we have had to go outside to other trusts for some of the rotations in the first year. And for that, that included the vascular rotation, which we've sourced at Peterborough, we work with them, and some of the pathology placements for the CA&I rotation that we've sourced from our neighbouring Addenbrooke's Hospital. So in addition to my clinical role, I recently undertook a secondment as Consortia Lead for Healthcare Science in the East of England. And this was one of a number of part-time secondments introduced and funded by HEE in a new initiative that they started last year. And in addition to my role as Consortia Lead, includes the Apprenticeship Lead, training leads in a number of different disciplines. And we've had 3 ICS healthcare science leads taken on recently as well to cover the 6 ICS in our region. So the group has a number of ambitions, but the main aim is to increase training capacity and capability in healthcare science across the region and improving awareness and access to healthcare science. If you're not aware already, we have created this East of England Healthcare Science Training Network using the Future NHS platform. And this already has a wealth of resources for both trainees and trainers. And it's being added to weekly, so please do join if you haven't already and give us some feedback. Next slide, please. So as a Consortia Lead, 2 areas were identified for me to start working on, the respiratory sleep and the cardiac STP programmes. And the first steps were to really establish current training and capacity across the region, but also looking for any limitations or barriers. And for this purpose, surveys were sent out to all the relevant departments late last year. And the next steps are ongoing, but include looking at areas where a collaborative approach to training may be beneficial or indeed necessary to access best practice and to ensure high quality training and consistency in training. So this includes supporting departments who may be keen in taking on STP students, but perhaps just need some help in the process of setting it all up. This might include the expressions of interest and accreditation, which is why I'm here today, and I've been involved in setting up this accreditation webinar. But also my role is to help with placements, to ensure that the curriculum requirements are all met by departments. So that may be help with rotations, setting up placement for rotations, or some of the specialist modules that may not be covered by the host department. And then again, we also are using regional training to help out, as well as described before on the Future NHS site with webinars, videos, case studies, etc. Funding for these posts has been agreed for the new financial year by HEE, so we're carrying on. But for me, the logistics of my clinical role mean that I'm not continuing with this role of consortia lead at the moment. But if you would like more information or would be interested in a secondment, then please do contact us using this generic email. Or contact me directly, as I'll still be very much involved with the STP programme. So thank you. So we can move on to the main event now, which is why you're here, about the accreditation webinar. The next slide, please. So in a moment, I'll introduce you to our three excellent speakers that we're going to have, but I'll just go through quickly how we're going to do questions at the end. We're using slido.com, so yeah, so if you can use your phone now to enter slido.com in your browser and then enter the event code accred22, so there's no need to log in. So I'll just give you a moment for all of you to hopefully be able to log into there. And so there's a question and answer tab, allows you to ask a question, and you can upvote and downvote questions by clicking on the thumbs up or thumbs down icon. So we'll collate those questions at the end and address all of them, hopefully, if we have the time. So hopefully you've all had time to join slido.com. And so we'll move on to the presentations now, and it gives me great pleasure to introduce our three speakers that we have today. We have Namir Al Hasso, who I've had the pleasure of working with for the last few months. He's Director of the STP Programme and also Regional Associate Dean at the school. We have Daine, who's the Accreditation and Quality Manager at the school. And also Liz Plumb, who's Head of Accreditation and Admissions. So thank you all for coming, and I'll pass you over to Namir. Thank you.
Thank you very much, Rachel. So good afternoon, everyone. So I'm Namir. I'm the, first of all, I'm a Regional Dean for Healthcare Science in the East of England. And what I'm so my other half of my job is to look after the STP Training Programme. So I'm just going to talk to you just a bit about an introduction to the school and how the school works and where the accreditation fits in. So the National School, as probably you're aware, that works in partnership with, so it's established by the Health Education, so it's part of Health Education England in the NHS, but we work quite closely with universities, we work quite closely with training providers and obviously Health Education England, as I mentioned, and professional bodies. To the whole purpose of this is to deliver a commissioned program to provide some training program for scientists in the NHS. So whether they are a scientist training program or the high specialist scientist training, so HSST, or the new program that we have, which is the ETP, which is the echocardiography training program. So this school in general, we've been quite unique as an organization within health education, providing responsible for training scientists in the NHS. I don't think there is any country or continent that has something similar to the school, so that's why we're quite unique. I think globally and even in Europe, there's no such a thing as the National School for Healthcare Science, so which is quite a good thing to be a leader in that area. So as a part of health education, as I said, we provide training for scientists in the NHS. We cover over 40 different specialisms. Some of you here might be from life sciences or physiological or physics, but within those three divisions we have a lot. And I shouldn't forget about bioinformatics as well, because they are important for our work. So if we think of the National School, the role it plays nationally, I think it acts as a deanery for healthcare science, a national deanery. So my boss, Professor Bernie Ferry, is the National Healthcare Science Dean, and we also kind of act as a Royal College for Healthcare Science, because we have curricula that we own, that we created, and we also have criteria that we set up for assessing these different programs. Just in the wider context of where the school sits, so the national school, I'll try to use my pointer. Here we go, sorry, oops. Yeah, so the national school obviously works very closely with the Health Education England. We're part of them, and we follow all the guidance and their policies because we're part of them, basically. However, we work very closely with this group of kind of organizations, mainly the commissioning team, which is a national commissioning team, which is part of Health Education. We work quite closely with the HCPC, who are the statutory register body that give us the registration as a clinical scientist. We work with AGIs, the universities, and we work with you, the trust that provides the training for the trainees or host the trainees that we have. But we also work with other bodies, for example, NHSCNI. So this is the NHS improvement and element of the NHS, if you like, where they usually provide us with, or provide the NHS with direction and national kind of picture, where the national push from government where we need to invest. So that's where they're a big part of this. Professional bodies, as I mentioned before, we work with all the professional bodies for the different specialisms that we have training program for, Royal Colleges if they exist, industry, diagnostic boards, ICSs, which is something obviously started happening recently. So we are working quite closely with ICSs. So for example, in the East of England, we have 3 ICS leads, each one of them covering 2 ICSs because we have 6 ICSs in the region. And on top of that, just recently we've been, there are a lot of training program directors, or 7 basically training program directors in the school. Each one of us will cover a different region. So I cover the East of England. Obviously, I used to work in the East of England, and I'm based in the East of England. So it just happens that I cover the East of England, and kind of I work with the local team within Health Education and the commission teams. So the national school work very closely with the commissioning teams, if you like, nationally and regionally. And as a school, we're not responsible, or we're not kind of the main people doing the expression of interest. For example, when we start the process of commissioning, its first process is the expression of interest, and that is usually mainly done at local regional level by the commissioning team, in collaboration with the national commissioning team, but also talking to us as a school. If you look on the next line, so we've got the regional health education healthcare science lead. So in our region, for example, in this box, we have Katrina Oates, who works quite closely with myself and with the commissioning team in the region, which is here. And I don't know, some of you might have heard of one of our colleagues in the East of England called Jen Bowen. So she is involved. She's basically the commissioning team in the East of England, looking after all the expression of interest, all the funding, and the salary support that comes with the trainees. And in the school, we have the accreditation team. So the accreditation team work quite closely with the 2 other, so the regional dean, the regional health science lead, and the commission team. But their job is to obviously accredit universities to provide the right, let's say, curriculum for the particular program, but also work with work-based department, that's yourself, to make sure that you're accredited. So you need to meet certain criteria to be able to provide training to our trainees. The commissioning cycle, just kind of, if we look at it in a cycle, where we start and where we end. So usually the expression of interest starts in August to October time, where we kind of ask for trust to give us expression of interest. That continues to October, where the commissioning team in the region will kind of look at the region and initially assess what's the request and what is needed, and is there issues in the department and so on. And then in December, we kind of things get finalized by the commission team and kind of in readiness to be handed over to the school. Between January and July, the school starts recruitment, obviously, and advertise these jobs, which is kind of close to where we are now in a way, because we're shortlisting at the minute. And then moving on from that, this STP trainees, after obviously successful process of recruitment, interviews, and so on, the trainee starts in September. And that kind of happens every year as a cycle. In April, May time, priorities area determines from national pictures. Like currently we're looking at the spending review, where there are priorities areas identified nationally. And obviously sometimes there are extra funding available for these areas. And then we go back to June and July, where we look at the recruitment process and look at the capacity versus needs, and back to where we started again. The expression of interest, obviously the commissioning team process this on a yearly basis. And as I said, it starts in the autumn time, and the training will start in September. So every September, if you have an STP, then they start in September, around beginning of September. It could be just after the beginning of September. If you want to express an interest of having a trainee in your hospital or your department, then you need to speak to the regional commission team and the regional healthcare science leads. And I mean, as I said, the regional healthcare science lead is Katrina Oates, and I work closely with Katrina. Obviously, we have also Rachel, and we have a team of trainers in the east of England that you can speak to us. It is really important, I think, for you, if you're interested in having a trainee, to speak to your trust lead scientist to let them know that you're interested in having a trainee, because some trust lead scientists will give you a very good advice on what to do and what you need to do, especially if you're not accredited and you start thinking about the accreditation. But also if you have a trust education lead or someone in the trust that looks after training in your area, you need to let them know as well. I think it's important for them to be aware that you have a desire to train someone on a new program that you haven't done before. There might be some conditions that you need to meet before you are kind of allowed to have a trainee or permitted to have a trainee in your department, in case there are some some areas that you need to work on. But I think most departments who wishes to take a trainee, I think overall it's all successful, and it's quite kind of a process that you can go through, and it's not something that is complicated. I think something we're happy to help, and we have a team that can help you in the East of England, and obviously the school as well, happy to help in that sense. So the type of post that we can have, especially for the STPs and the ETPs, so you have a direct entry who is a trainee who will come to your department from the national pool, so has never been to your department. And the in-service trainee is someone who's already working in your department and have a post, but they want to do the training program. And the difference between the two, in the past, there used to be a financial difference in the support that the department gets from a salary and from support. But since probably 2 years ago, this is all equal. So direct entry and in-service get the same kind of salary and same kind of support, which I think it was really helpful to many departments, especially in the East of England, where people start taking in-service trainees. So as an employer, to host a trainee, what do you need to do? So obviously you need to demonstrate to the commissioners and to the school that you meet the requirement of what the school asks you to have, so accreditation standards basically, but also part of this is to meet the health education quality framework. And obviously evidence, that you might submit evidence to meet those requirements. And you can express an interest and apply for the accreditation at the same time. However, you need to be accredited before your training starts in your department. So usually, as I said, September, so basically before September, you need to be accredited by the school. So there's plenty of time between expression of interest until the training starts, but I would always encourage you to start early and start asking questions and looking at the documents. So again, what is expected of you? What do you need to know? So you need to understand the specialty that you delivering, the curriculum of that particular program that you're delivering, the structure and the requirement of the program, and how you plan to deliver them. As you all know, there are rotations first year, and these rotations are where your trainee goes and visit. They go and visit other departments or other services. But also the specialist training that you need to provide. So as they progress in second year and third year, this is mainly STPs I'm talking about here. Again, there might be some rotation that you might need to arrange and plan for your trainee. You also need to make sure that so you know or the trainee knows who's the person responsible for them, who's the training officer, and who is the person looking after the training on a day-to-day basis. It depends on the structure in your department. If you have a big department, you might have one training officer that looks after a lot of trainees, but each trainee will have a specific kind of a training officer. So whether they're training or coordinators and training officers, multiple training officers, or you might have just one person doing both roles because your department is quite small. You need to have policies in place for fitness to practice, for public and patient involvement, quality, diversity and inclusion, whistleblowing, and some of these policies already exist in your trust. You might not just need to you might not know of them, but they do exist. You just might need to dig in a bit to find them, and then maybe apply them to your department and create a policy for your department. You need to think of the experience of delivering. Sorry, you need to let us know if you've got any other experience of delivering any kind of other training. So, simple example: if you looking to be accredited by the school, let's say for a life sciences program, but you already been training, let's say biomedical scientist, and you have an IBMS accreditation for years. So it's good to let us know because and some of the evidence that you submit for both could be very similar. But it's from our point of view, it's good to know that you're accredited by another organization as a training center. And as a department, you should have a training policy. So usually when you have trainees, you should have a training policy. I think includes staff as well, not only trainees, but also a training plan per trainee. So who's responsible for the STP trainee or training? So each trainee will have a nominated training officer, as I mentioned before, to oversee their training. But again, depends on how the structure of your department. If it's a big department, or you might have a training team, or if it's a small department, you might have one person doing, kind of everything. But really, all your staff in your department needs to be aware of the STP training, what is the STP training, and why the training is in your department. Quite often we get trainees in second year where they say, nobody knows who I am and nobody knows what I'm doing. And it's quite important that at the beginning of the training program, you introduce them, you let them know you let your department know of the STP and how the program the aim of the program. Including non-scientific clinical staff, because you might need to be involved in your training for the trainee. There are a lot of elements of providing a service that includes non-scientific staff, could be medical, could be nursing staff, could be admin staff as well. So it's important to understand the roles and responsibilities of trainers and where they fit in with the trainee. So the training officer should be providing a comprehensive, if you like, a training plan. But maybe at the beginning of the program, you start with an initial training plan. But as you progress further, it gets kind of more you alter it according to your trainees' progression, but there is some kind of a basic training plan that you need to follow, and this will be adapted per trainee, so differentiated as per your trainee. You might have 3 trainees. Each one of them might have a different, slightly altered training plan. When I say altered, what I mean by that is your trainees are different. You can't treat them all the same. So some of them might be very well experienced in a particular area, but not other elements of the curriculum. The trainee, obviously, it's a postgraduate training program, so we expect trainees to take full responsibility of their training and their own learning, but also, obviously, we need you to be with them as a training officer and as a department to support them and be with them in all the steps. And in any training journey, to be successful, it's really important to have a collaborative approach. So you and your trainee have or your training team and the trainee have a very good kind of communication between you and the trainee, whether it's one-to-one meetings. We recommend one-to-one meeting at least once a month, if it's not once a week, and kind of to address any issues that the trainee is having. And just in general, trainees get more confident as they progress in their training program. So they might start a bit less confident, if you like, and then as they progress, they get more confident. You need to remember that the trainees are supernumerary, whether they are direct entry or whether they are in service. They're supernumerary. They're not there to be part of the team to provide the service. They're there to train, but as they progress in their training, you might need to, obviously they need to do some element of the service to meet their training requirement. So what should I include in my training plan? So a weekly breakdown of all the curriculum. So you look at the curriculum, which is available on the curriculum website. You can download it with specialism, and you need to show us how you're going to meet these learning outcomes. Again, as I said, trainees are supernumerary, so 20% of their time is allocated for training. So 1 day a week, roughly, for the trainees to have a study day. And it's the 20% or the 1 day a week. As I always advise as a previous training officer, that trainees will take them in discussion with the training officer, but take them when you need them and don't take them if you don't need them. But you can accumulate them if you have an exam period, if you like. But this is in discussion with you. They can't just decide to do, I'm going to do this without speaking to you. So training officer is important to be aware of this. Rotation needs to be organized and planned as well on the training plan. And the trainee should know where they're going, who they're going to speak to beforehand, and who's responsible for them during their rotation. It's really important to give them time to do the online portfolio and the workplace assessment, because that needs time to complete. Allow time for one-to-one meetings, progression review of the trainee. Feedback is big important element of any training journey, so you'll be giving your trainee a feedback, and again, as I said before, that varies from trainee to another, so you need to adjust that. Add key dates to the training plan, such as university components, exam time, the midterm review of progression that the school does at 18 months, the multi-source feedback that you have to do before that, and the final IAC assessment. So all these important dates. Annual leave as well. I recommend that you add it to the training plan, if possible. Also roles and responsibilities of various people or individuals that are dealing with the trainee or responsible for delivering the training. Again, it's really important to add it to the training plan so the trainee is clear. If I'm doing this module, I can go to the particular person. I think a little bit about patient and public involvement. So this is something that is important to be part of the kind of accreditation. So you need to show that you do patient and public involvement for the trainee, and this could be something that needs to be stated on the training plan. You can outline the opportunities of what you need or what you think the trainee should do to meet these patient contact or patient public involvement. If you are a non-patient facing department, there are a lot of ways that you can do this. I think in the past, as I'm a life sciences, my background's life sciences, and again when I looked at this, I thought, I don't know how I'm going to meet this, but I did. We looked at the trust policy, and then we came up with a good system that worked. So the aim of the PPI is to get the trainee to understand how the patient's kind of journey, how their specialism is affecting the patient journey, treatment, diagnosis, and so on. And a simple example of this to get the trainee to do be part of STEM or be a STEM ambassador. The trainee could attend some patient groups or participate in initiatives such as the Healthcare Science Week or the Big Bang Week, where trainees can speak to the public or patients. Sometimes asking the trainees to design a leaflet for your department. What do you offer for the patient, and that kind of thing, which usually sometimes if you're non-patient facing, you don't think about these things automatically. I think that's all I've got to say. I'll pass over to my colleague Liz. I think we'll have questions at the end of the session.
Great, thank you, Namir. So as Namir has just said, my name's Liz. I am the Head of Accreditation and Admissions at the National School. I'm very conscious of time, so I'm actually going to rush through some of this a little bit, just so that we're kind of halfway through our presentation, but I want to make sure there's time at the end, so we've got some questions that you might have for us. So this is the accreditation team. There's myself there, there's Jazz, there's Rachel, Nicola and Sarah. We all deal with accreditation matters. Quite a small team, quite succinct in terms of what we do, but obviously they're friendly faces. We are an approachable team. I wouldn't like to think that we're not approachable. So as you can see, any queries, there's a National School of Accreditation email address there. If you want to contact us, you can do. That's absolutely fine. We're here to help. We're not here to pass judgment. We're here to support you and your colleagues, be it through the workplace, be it through our HEI accreditation. We are, as I said, we are friendly, we are approachable. If you have a question, don't think that any question is a silly question. If it doesn't make sense to you and our guidance that we've given, please come and ask us those questions. We will help you. Chances are somebody's asked us that question before. Chances are there's another department in a similar position to yourself. If you're not quite sure in terms of the process, in terms of if you need somebody to be buddied up with, in terms of either delivering some training or just understanding any of our processes, like I say, come and talk to us. We can set up meetings, we can set up Teams calls. That's absolutely fine. We are here to help, basically. So what are we responsible for? I think some of this has already been covered. So we accredit work-based providers for the STP, Scientist Training Programme, for the HSST as well. We accredit the universities delivering the programmes. We also accredit PTP provision in terms of undergraduate provision in terms of the HEI work. We've got a lot of work going on in our team, if we're really honest about it. Like I said, we are quite a small team, but we will try and deal with everybody in a timely manner. We tend to set deadlines in terms of kind of first accreditation, normally around 8 weeks. But like Namir has already said, if you're thinking of taking a trainee now in 2023, which would be the next expressions of interest in terms of that will be the start date, September, October time 2023. Come and talk to us now. Don't think that this is a long way off and you've got plenty of time to do this. There's a lot that needs to be done in terms of the work and the filling in of the paperwork where we are concerned. But do come and talk to us and we can help you and guide you through that. There is a requirement for all work-based providers to provide annual monitoring on an annual basis. It's not an onerous task, it's all done online, but it is a requirement of accreditation. So, as we've said, we work with a range of people. We work with our regional and our national commissioning colleagues. We try to understand what the requirements are in terms of who wants an expression of interest, to see actually, are you accredited? Yes, no. Are you having any difficulties with training? Because what we don't want to do is we don't want to put any trainee in any department where we think that there might be some challenges in terms of being able to assure us of the kind of the quality of the training environment. We talk to you, we will guide you through that process, as we've said. come and talk to us. I can't stress enough, please do come and talk to us, because we can guide you through, you know, we've done a lot of accreditation over the years. We've got lots of training plans, some good examples, some not so good examples that we obviously won't share, but there are exemplary training plans available on the website, but we can send you some if you're just not quite sure what you need to do and what you need to tell us that you've got in terms of how these opportunities will be. Because 3 years for a trainee in a department is quite a long time. You need to ensure that from the moment that they walk through the door that you've actually thought about the training, you've got a plan for it, and you've got relevant staff there that can support those trainees through the programme, because otherwise you're storing difficulties or challenges up as you go through the programme. You need to have a very clear plan before they walk through the door. And this just shows that we have regular meetings. We are connected very clearly to our HEI colleagues as well. We don't just sit and deal with workplaces. We talk to our HEIs and see some of the challenges they've had. The impact of COVID has had quite a significant challenge for some of our HEIs. They all moved online. We've now got a bit more of a blended approach, which actually is a pretty good approach in terms of how it stands, in terms of not requiring all of our trainees to go to university and to physically attend all of the time. There's more of a blended approach in terms of how things are being delivered at this moment in time. So this is just the figures. They're quite scary when I look at them like this, and I can see the hundreds of departments and or departments have been either accredited or endorsed. So that's quite a lot, and it's a credit to my team in terms of how they've dealt with this, in terms of the years that we've spent dealing with accreditation. So what do we do? So we accredit a department in terms of 5 years, and then it's reaccreditation. Again, what we've said, it's not about surprises. We are very clear what the requirements are in terms of the documentation that we need. There's lots of guidance that can be issued. Like we say, we can provide support if you feel you need some. In terms of the universities, they're accredited on a 4-year cycle, just because that's a slightly different approach. But we try to ensure that every workplace and every HEI is accredited before a trainee walks through the door, so that we are clear that we are spending, obviously, HE's public money in terms of training and ensuring that actually these are viable training environments and the support is there for our trainees whilst they're on the programme. Obviously, these are the expressions of interest for 2022. So as you've heard, I also am responsible for recruitment. So my also small team and recruitment members of staff, we are trying our very, very best to hit all of these in terms of the totals that we've got. This is year on year. The numbers of expressions of interest seem to be rising, which is fantastic in terms of the healthcare science workload and the workforce. But all of these departments, we need to ensure that they are accredited, like we've said, so that when trainees walk through the door, they are clear. There's a clear training plan. There's clear guidance who will support them, and how that will kind of manifest itself, whether the 3 years for the STP and the 5 years for the HSST. Like we said, we are supportive. We're not ogres, I promise. If you have any questions, do come and talk to either myself or Jazz or Rachel within the team. We can support you through this. Don't think that you're on your own. If it isn't clear what we're asking, come and ask us the question. You know, we are here to help and support you through it. And then I think at this point I'm handing over to Jazz. We're very conscious of time, so we are kind of whistling through these last few sections, if that's okay. So over to you now, Jazz.
Thank you very much, Liz. So I'm just going to carry on, and I'll try and be as quick as I can, because I do want that time for questions for yourselves. So what is the accreditation or endorsement process? We ask you to fill an application pack, and that normally involves a large application form. So the quicker you start on it, the better it is. We ask for evidence of another form, which is the evidence of meeting requirements for a training officer form. So that's for the person that's going to be responsible on a day-to-day basis for the trainee in your department. We also ask for an education and training qualifications form for all members of staff who will be involved in training. So, you know, with the trainee, so we ask for their details as well, so we know that they're at the right level to be helping with the training. We do say accept CVs as an additional resource also. The other aspect of the application evidence that's really important is the training plan, which sets out how you plan to deliver the training across the 3 years, and your public and patient involvement plan, which tells us how you plan to give the trainee opportunities about working with patients and the public. We also like to see a range of your trust policies and an organisation and structure chart showing us clearly how the trainee will be supported and managed within the department. So those are the main aspects of the accreditation process. So moving on, we've got the new STP curriculum as well that starts in September 2022. So if you're a department that's already accredited, your trainees who are already started within your department will stay on their existing curriculum, the one they started on. Any new trainees will start on the new curriculum, which is from this year's September 2022. So any new departments coming on board will be accredited with the new curriculum as we go on, and reaccredited also for the new curriculum. But you may have trainees that are on both the old and the new curriculum within your department, so that's just something to be careful about. So what we're asking for is, if you're an existing department, is to make sure that your training plans for 2022 are with us for those new trainees that you may have had an expression of interest for. So we want to see those as soon as we can. We have given a deadline of the 27th of May. Some people have had a longer deadline, that depending on when you were accredited. So that's just something to bear in mind as well. As Rachel's already spoken earlier, there are consortium arrangements, and now the consortium is an idea where departments can work with other trusts or organisations to help you deliver parts of the curriculum that you're unable to deliver yourself. It also helps you share the delivery of rotations, so it's a really good idea if you can be in a consortium, and it helps to increase your collaboration and share knowledge and best practice as well. So it's a really good idea, especially if you've got niche areas of curriculum that only particular departments are able to deliver. So what I would say is, not sometimes there are requests where departments want to work in a consortium with a department that offers that niche curriculum, but they may not be accredited. Now, we do ideally want all departments to be accredited if they're delivering training, but if it's just one aspect and they already have some sort of other accreditation like UCAS, then there is some flexibility there that you are able to work with that department. What I will say is the website has just been updated with lots of new information and resources. So if you go onto the information and resources section and then go to accreditation, you can see that there's lots and lots of information available, whether that's about the application pack and process, whether that's about hosting a trainee, or just about reaccreditation. It's all there. And you can have a look at what area that you want to read about. There's also some really interesting resources there for frequently asked questions that you might want to look through, and other documentation that might be of interest for you. And that's it from us. So thank you very much. And now we're going to the questions section. So I'm just going to unshare my screen. Okay, so that we're able to see everybody. So what we'll do is we'll go through the questions on Slido, and then we'll make it sort of an open forum where you can raise your electronic hand and unmute yourself and ask any questions in person. So let me just see if I can see. So we have got some questions for you, Liz. First of all, do departments have to keep a post available for in-service trainees who do not complete their training or wish to resign?
That's a really tricky one. Obviously the money is given for that particular individual trainee, be them in service or direct entry. We ask that you continue their employment. So how you manage that would have to be left to your discretion. But the expectation is that if you've got an in-service applicant, they would join the STP, but at the end of their programme, in theory, they revert back to their substantive post. But obviously, we want them to go on and to be bigger and better things. So you would hopefully, at the end of their programme, you would hope that they were applying for other internal vacancies within the trust. But that is going to be dependent on what those vacancies and those opportunities are within the trust. More often than not, a trust would actually do backfills, so they would use the money that would come in to actually backfill that particular post while that person is on the training programme for 3 years. Occasionally, some trainees don't like the programme. That does happen. We obviously try and spend a lot of time and effort in terms of our promotional materials. There's a webinar we do in terms of recruitment to try to get folk to understand what they're applying for. It doesn't always work. Sometimes it just isn't for those individuals, and that is a tricky time, in fairness, in terms of their substantive post should be available. It isn't always that it's as simple as slipping them back into their substantive post. There might have to be some kind of movement around that, but obviously that will be in discussion with your HR department. So the simple answer is yes, there's an expectation that actually their substantive post is there. It's very tricky if they resign from the STP partway through. That is incredibly difficult to manage, both from the trust perspective and the school's perspective, but it does happen.
Thank you, Liz. I have another question here. It says, will we need to apply for accreditation of departments with the school if we employ apprentices at level 6 or level 7 when available?
We haven't decided that yet. So you mean in terms of what we do? So you mean it's separate from the STP in terms of the programme at the moment in time? I believe that could be the case. Obviously, for the level 6s apprenticeships, you can apply through the PTP in terms of the kind of current accreditation processes. The level 7 is it's not quite there yet, as I understand it, in terms of the actual sign on the dotted line where the school's responsibility lies at this moment in time. So it's a watch this space, and if anything changes, obviously we'll promote it through the school's website and or our newsletters. So just in case anybody hasn't, sign up to the school's newsletters, and a lot of information will come your way on a monthly basis, both for the ETP, the STP and the HSST as well.
Thank you, Liz. And if you want to sign up to the newsletters, you just have to go onto the website, and there's a contact form there that you can complete, which then makes you a member of the newsletter. So the other question I have here, again, this is for you, Liz, another one, you're very popular today. In cardiology, is there a separate department accreditation for STP and ETP, or would STP accreditation cover the ETP trainees also?
Right, it depends on, in theory, yes. If you're accredited for the STP, because a lot of the programme is the same, so STP and the ECHO programme are very, very similar. Obviously, different levels in terms of the time on the programme and the depth of the programme. If you have STP accreditation, we just want to understand a little bit more information in terms of who will be supporting the ECHO trainees once they're on the programme. So what I would suggest is you come and talk to us. We can guide you through it. It's not going to be a case that you have to then go through the whole process again for the ECHO programme. That's not the intention at all. If you're not accredited for STP but you want to be accredited for the ECHO, that's also okay, but you would need to provide us with more information. So if there's a department like that, can I suggest you come and talk to either myself or Jazz or one of the team, and we can guide you through that process. But yeah, we don't expect you to jump through too many hoops in terms of both STP and ECHO to be able to deliver the programme, because if you're already delivering STP, you're basically halfway there in terms of the ECHO programme.
Thanks, Liz. Namir, we've got some questions for you as well. Do the BMS leave the current post to have an in-service post to become a trainee? I think that's what it says on Slido, so I'm not quite sure.
I think it's possible for biomedical scientists to do the in-service STP route. They don't have, I mean, basically they start a new contract. I guess if the trust would like to leave their previous job open or find someone else to do it.
Namir, I think that's very similar to the question that was asked earlier in terms of, I think it's just a different terminology. I think the question probably is, if somebody wants to join the programme, do you leave their substantive post open? I think it's the same question that we just answered originally. I think it's one of those very difficult ones. You expect them to have a substantive post, but obviously you want them to go onto the programme and complete all of the programme and then either revert back into their existing post, or ideally, at the point of graduation, you want to go on to bigger and better things. So I think the answer is yes. However, it can be very tricky if they don't progress to the end in terms of the 3 years on the programme.
Thank you, Liz and Namir. Next question. I think this one's for Liz. Is there HEE funding or role descriptors of a training officer?
Yes, we've got lots of information on what we expect of a training officer, lots of information on the website. We also run what we haven't actually, I don't think we've promoted this yet. Once you're ready to take a trainee, there's online what's it called? Train the Trainer. And I know that because Jazz used to help us with that, in terms of Jazz used to be formally responsible for that, but it's no longer running that particular program. So we do provide Train the Trainer, and is it advanced Train the Trainer? I think that's right, for people that need more information or needs extra additional information. So don't just think we just kind of go, okay, you're accredited and off you go. We don't leave you to your own devices. There's lots of touch points with the school that you can come and talk to us and provide training that can help you guide you through those processes. But yeah, all of that is available within our accreditation pack that Jazz has already referred to, but we can send those links if anybody wants to see those. That's absolutely fine.
Thanks, Liz. And it is part of the accreditation process that anyone who is a training officer attends Train the Trainer as a induction, so they know what their responsibilities are as a training officer. The next question, I think this might be for Namir. Is there a role for STP reps? Now, that's all it says. So I'm not quite sure what that question means. Whoever's asked that question, if you want to just unmute yourself and let us know what you mean. Okay, we'll come back to that one. Will there be similar 18-month programs run for pacing invasive areas like the ETP program? I think, again, that's Namir.
Yeah, I mean, I think at the minute we've got the echocardiography training program. There are other programs in development. I think there's a respiratory one in development. I think if there is a need in any in the NHS for any kind of program, then our job to work with the stakeholders, professional bodies to create a program. And an example of this is I'm currently working with genomics to create something similar to the ETP, but for life sciences. So if there is a need, well, the school is happy to be part of this to create a program.
That's lovely. Thank you very much. There's no more questions on Slido. So what I am going to do is go over to any electronic hand questions. So if it's not something that you've put on Slido, but you've just thought about something and you want to ask that burning question, here's your opportunity. Just put your electronic hand up, unmute yourself, and let us know. Yes, I have a hand from Anne. Anne, would you like to ask your question? Right. For some reason, you're saying you cannot unmute yourself. That's very weird. Let me see if I can do anything about that.
So try again, Anna.
Can you hear me now?
I haven't.
Yes.
Yes, you can, because I haven't unmuted you from my end, I can assure you.
Yeah. Sorry.
That's okay.
I was just saying, by the time you were talking at the end of the Slido, I was putting that question in, but I'll just repeat it. I just wanted to know how much of lab involvement is required for the STP trainee. Does the school specify or leave it to the departments to sort that out?
So in terms of like a laboratory hands-on?
Hands-on, yeah.
I mean, obviously there are competencies and they have to meet those competencies, and some of them will require some laboratory element, yes. But I mean, I'm just going to, they're supernumerary, so that you're not expecting them to do the service.
Yeah.
They're not providing service. So if there isn't a competency they need to meet, they'd be in the laboratory to do it, yes.
Yeah, okay. Thank you.
Any more questions? Okay, I can't see any more hands up. You should be able to unmute. I haven't muted anybody from my end. Okay, Michael.
I'm with the cardiology department. Just wanted to double check where I could find the details and the accreditation kind of supports and things like that.
Sorry, you're very faint, Michael. Could you repeat that, please?
Sorry, yes, is that better?
Yes, that's a lot better.
I've got my headphones on. I've just turned on my microphone from listening to talking, i.e. I've pushed it down. Sorry, I just wanted to double check where I can access the information that you've talked about. So these kind of support things and the accreditation packs and things like that. Where do I look for that?
They're on the website. I'll just put the link into the chat now for you.
Fantastic. Thank you.
Okay, so let me just do that while we're still all online, because I know you don't get access to the chat once we go offline. So I'll do that now. But if anybody else wants to ask another question while they're waiting, please feel free.
Jazz, there's a question from Hannah.
Sorry.
It's just about reaccreditation process after 5 years from Hannah in South Essex.
Yeah, so basically, whilst you're accredited, every year we expect you to complete annual monitoring. It sounds worse than it actually is in terms of the requirement. It's an online form, and what we're really looking for at that point is, has anything changed? So from the point you're accredited to the point you're filling in the annual monitoring, has anything changed? Yes, if anything's changed, be it somebody's changed, staff members change in terms of who's responsible. If you've forgotten to tell us, it's our way of checking that actually all of your ducks are in a row in terms of you're still able to deliver the training, basically. So that's year on year. And then the reaccreditation process is very similar to accreditation. What we're trying to do is just make sure that everything is there, all the policies are there, you've got the support there, you've got the staffing in place. It's basically a kind of a repeat after the 5 years in terms of what you've already told us. If information is there and you're doing what you are already doing, the reaccreditation process generally shouldn't be too onerous or a task. I think the challenges some departments have is when things have changed and whether they've had like a reconfiguration or they've had staffing changes, then obviously that is when the kind of challenges could kind of kick in. What I would suggest to any department, if you're already delivering accreditation and things have changed, come and talk to us. We're not in a process of systematically stripping accreditation away from people. That's not the intention at all. We want to accredit and work with as many training departments and departments as we possibly can to ensure that we've got the capacity within the workforce to train healthcare scientists. So don't sit there and think, oh my goodness, something's changed and a certain member of the team's left and I can't deliver this. We can help you and guide you through it. We can't solve any staffing issues that you might have, but we can guide you, shape and kind of hopefully buddy you up with others if you need to seek some help and support in terms of being able to continue with training.
Thank you, Liz. I think there's one final question. Are we prompted for the yearly review or expected to do it ourselves?
Yes. Don't worry, we won't let you get away with it. We will send you email correspondence in terms of asking you to do it. What we also tend to do is we send reminders. We have it within we have a lady in the school that helps with all of our communications and our stakeholder engagement. It will be in a newsletter, which is why we're encouraging to sign up to the newsletter. It would be all over Twitter and saying annual monitoring is open. It is only for the department, so we don't expect trainees to fill the annual monitoring in. It's about you as a department and what, if anything's changed. If everything is working and there's no issues whatsoever, you'll sail through the annual monitoring process. It is just a way of making sure that actually everything is still okay in terms of what you told us, in terms of being able to accredit you from the first kind of interactions that we've had with you.
Thank you, Liz. We have 1 minute to go, so if there's any other final question before we draw to a close.
Jazz, I've just spotted a comment by Catherine Tolfrey in the chat. It says, I can't unmute myself, but I was wondering if there is a forum for learners via reps to give feedback with the school or regions, a mechanism for learners' voice.
Currently, there was talk at the school to develop forums, and that's something that the digital team are looking into. So it will be something that we will definitely be offering in the future. So there's going to be forums where learners can actually interact and talk with other learners online, but that's still a work in progress because we are so limited at the school with our resources. But that's not to say there are networks that the school manages across the country of trainees where you are able to contact one another, get help and advice from other trainees. So there's the regional trainee networks and the BAME Scientist Trainee Network as well that you can contact. All the details of those are also on the school website. If you just type in regional trainee networks, they'll all come up. I hope that answers your
Okay.
question.
So I think it just falls then to me to close this webinar. I'd like to thank our 3 presenters for the really detailed and comprehensive information that you've given us today on the accreditation process. It's been great, and I can vouch from personal experience that the going through the reaccreditation, that the resources on the website are really useful and very detailed. So yeah, thank you very much, and thank you all for joining today. Thank you. Goodbye.